Times are changing. Countries worldwide are clearing their environment from tobacco smoke to protect people's health. This ongoing process includes the creation of tobacco-free environments and the introduction of other anti-tobacco initiatives. It is the result of many years of struggle that led to the entry into force in 2005 of the World Health Organization Framework Convention on Tobacco Control.
The Framework Convention for Tobacco Control is an international treaty. And it's very important for public health because for the first time there is a legal basis for governments to be able to tackle a public health problem. By implementing the treaty, a country is able to reduce the demand for tobacco and also to reduce the supply of tobacco products. In effect, if the supply and the demand for tobacco are both reduced, fewer people will be using tobacco products, and therefore fewer people will be suffering from diseases that are caused by tobacco.
I agree with this regulations since it helps in maintaining the health of people, and I think people should respect others when traveling in a bus and should not smoke.
I've noticed that most passengers now are becoming more health conscious, and on our terminals we've seen less people smoking. So there is a great improvement on this campaign of non-smoking around the bus terminal and in our premises. There's a fine, and the fine comprises of a fine of 1,000 rupees or imprisonment of 2 years, depending on the gravity of the offences.
We are lucky. We don't have any strong opposition to these kind of actions. And I think this is clearly in continuity with policy and programs that we have been doing for more than 20 years. And the decrease of tobacco over the years is a proof that many things have been done. But still, taking any kind of new regulation and legislation is no easy step.
Hadema tries to give maximum confidence to its clients. This has resulted in the fact that people are willing to have non-smoking areas. I think it's a good thing for the environment and for our health. Tobacco is extremely dangerous to health.
La cigarette agit sur les yeux, la peau, les poumons, le cœur et même sur le cerveau.
À partir d'aujourd'hui, docteur, je ne fumerai plus.
The Framework Convention on Tobacco Control also requires countries to introduce health warnings on cigarette packs.
Mauritius, if I'm not mistaken, is among the few countries in the world who has introduced graphic warnings. In fact, we have introduced 8 pictorial warnings, and this is, I think, it is proving to be a very effective way of preventing tobacco. And also we have made provisions for electronic cigarette to be banned. In fact, it's prohibited to smoke in public places. So we have our inspectorate division who, with the collaboration of the police, we usually conduct from time to time certain crackdown operations in the field, in the public places to ensure that people do not smoke in public places.
Tobacco is the #1 risk factor for non-communicable diseases. Each year, it kills 5 million people worldwide, including non-smokers who, by inhaling other people's smoke, are exposed to the same health risks as smokers. Half of these deaths occur in the African region. The World Health Organization estimates that 6 to 36% of adults in Africa smoke.
Africa is at the brink of a catastrophe. The epidemic is at an earlier stage in Africa, but we see some real warning signs in the continent. We see tobacco companies aggressively marketing their products in the region. We see tobacco companies targeting young people. We also see some worrying trends. We see, for example, youth between 13 and 15 years of age having a much higher rate of tobacco smoking in the African region than adults.
Le tabagisme, la consommation de drogues illicites constitue des risques pour la santé. Et il y a lieu de mieux contrôler ces facteurs de risque à travers une bonne information au public pour que la communauté, les individus puissent prendre des décisions, faire des meilleurs choix par rapport à leur style de vie. Et vous avez un rôle très important pour informer la population et permettre que les mesures préventives puissent être prises au niveau des communautés, au niveau des familles et au niveau de chaque individu.
Countries have the duty to implement the obligations of the Framework Convention on Tobacco Control, including alternatives to tobacco growing. Malawi, for instance, which is a tobacco producer, is in the process of introducing alternatives to tobacco growing and ratifying the treaty.
We are in the process of drafting a paper for the cabinet to look at before it can then go on to Parliament. So as soon as that process is done, we'll be able to ratify it. Tobacco is a major foreign exchange earner for Malawi, so we cannot work alone as Ministry of Health. We have to work with our colleagues in the Ministry of Agriculture to see how best we can move forward to create alternatives.
So these alternatives need to come with a good strategy for marketing those products so that the farmers who shift from tobacco to any of the other possible crops can find easy and available market for their products.
Malawi is rich in many fields. We know that we have tea, we have cotton, we have the fishing industry, and then even among the crops, cash crops, we can diversify into other cash crops to enable the country get the much needed foreign exchange. And of course, lately we've also found a number of minerals in the country, so maybe we can go into an alternative way of getting this income for the country than to rely too much on tobacco.
The Framework Convention on Tobacco Control has already proved its efficacy in the fight against tobacco. But more must be done for the treaty to reach its full potential. The World Health Organization urges countries to put the convention at the heart of their efforts to control the global epidemic of tobacco use.
The world community, under the Framework Convention on Tobacco Control, has undertaken to negotiate a new treaty. They're in the advanced stages now of negotiating a new treaty on illicit trade, and we hope that that will be adopted by the parties to the Framework Convention in late 2012 at the next session of what's called the Conference of the Parties. The Conference of Parties is the body that overviews the implementation of the treaty. The priority is to get the entire world community to sign on to this. This is a very urgent epidemic. It's a serious epidemic, and future generations would never forgive us if we allow the tobacco epidemic to continue unchecked.
The WHO Framework Convention on Tobacco Control has opened a new door in public health. It is now an obligation for governments to protect their citizens from tobacco smoke. It is now an obligation for governments to ensure that the public are getting the correct information about tobacco and its progress. Therefore, the fact that there is a legal obligation is new in public health, and therefore this treaty is going to encourage governments to have laws that protect the public, and also going to reduce non-communicable diseases because they are on the rise currently. So this treaty is good for public health.